Transitional care at George Mark can do one of two things. It can shorten a hospital stay because it can complete a course of therapy that's been started in the hospital, for example, a course of antibiotics, or transition from a certain type of a treatment to another one that needs to be monitored medically but doesn't absolutely have to be done in the inpatient hospital setting. And it allows the family to be together if there are brothers and sisters or extended family. It allows them all to be together while still having the child receive the appropriate medical care.
We heard about the George Mark House when we were inpatient at Children's Hospital, Oakland. A lot of the staff, the nurses, the doctors, everyone in the ICU ward, they all told us about the George Mark Children's House. I was wondering why everybody kept telling me about the house. Initially, I just kept saying, okay, give me some time, I'll think about it. But we just had too much going on at the time, and I couldn't see even stepping away from Jeffrey to come over to take a tour of the facility.
I know friends of ours that we've talked to kind of feel a little squirrely about coming to visit because they think they're walking into a depressing building.
We were reluctant to go to the house initially. I think for me, it was because fear of the unknown.
And it's been said more than once that until you walk through the door, you really don't understand.
So it took us about a year to actually say, okay, we'll go and tour the facility. And after that, the rest was history.
This is a place designed for what we're going through. And it does feel like you're hanging out at your rich uncle's mansion. I don't know, I can't tell you the reaction exactly, but looking on the website, it was like you found, a crown jewel or an oasis that could help you in one of the most dire situations any parent can be.
Here at George Mark, we attempt to allow that child to have the maximum quality of life possible while at the same time providing the medical interventions and the medical care that that child needs.
George Mark was awesome compared to the hospital. The hospital atmosphere was a bit overwhelming for us at times.
I don't know how you get well in ICU. I mean, all the beeps, the machines, everything going on.
Coming to the house provided us with peace and comfort and support and lots of love for not only Jeff, but for my husband and I.
Coming here, it brings normality. It brings breakfast, lunch, and dinner at pretty much the same time. It brings paintings. The OK Corral room is a whole lot better than the sterile room that you'll be in at a hospital. And we're not quite ready to be home with him, but we're almost modeling here what home will look like.
I wanted Jeffrey to be in another atmosphere away from the hospital. I wanted him to experience interacting with people, experience other opportunities like playing in the different rooms that they have, playing with other children, getting in the water.
Our motto here is whatever works. So we don't try to look at what we can't do. We try to look at what we can do. I think that the hydrotherapy system looks very simple and is in fact an extremely complicated, even if you want to call it a medical intervention, but it's a very complicated part of the therapy that we provide for these children and their families.
Where do you go when your kid's been paralyzed? And how do you learn how to take care of them?
The other thing that transitional care can do is to allow the parents to learn hands-on in a very home-like setting, in a setting that would really mimic real life. And at the same time that they're learning that, they have the 24/7 availability of the nursing staff backing them up and helping them refine their techniques, helping them really learn the appropriate safe care of their child at home.
So we're here for transition, and the staff is helping us and giving us the space to be able to learn how to use a lift. But I miss the routine, and so here I've been able to shave him a few times. We can do a shower, but they're helping us learn how to get him on the shower chair, get him out of the bed. So the staff has been wonderful, in helping learn how to do certain things and giving us the space and feeling like we're learning how to do it at home but you can pull an emergency cord, or you can get some help.
Once they get home, they feel much more confident that they're much less likely to have to take the child back to the hospital for some sort of a problem, because they're able to solve those problems, generally speaking, on their own at home. It's like going to school to learn how to care for your child.
The whole family can stay with the child while they're there for care. Even the family pet can stay at the George Mark Children's House. The house has a suite for families to stay in while your child is in a room.
Kevin has a brother, my stepson Rich. Having Rich come here is another, so your brother's here and it's like home again. And having Rich in the water with Kevin, I mean, you know, it feels like they're sitting in the hot tub together or something, and I just think it gives him the ability to feel like he can do something positive to help his brother.
So this is our Great Vibes room, and it's used for a variety of patients and a variety of situations, but especially children that have some neurological difficulties or difficulties concentrating often find this room to be very soothing with the lights and the patterns and the music. We have a big mat where children can just romp on the floor. We have the LED lights that are good for texture and color. And the hammock here is on like a Hoyer lift system, so patients or family members can comfortably swing in this hammock. It's very supportive on the body. Okay, so this is our playroom. We have a general sort of lounge area, pool table. We have a train set that we're working on restoring, and there's a piano in here. Actually, one day a week we have a music therapist who comes and plays piano here. The TV has a Wii, and so and then in the back and along the walls, you see we have things for younger children too. So it's a nice place for families to come. We can really entertain anybody from an infant to adults and parents and relatives. So we have 8 patient rooms. 7 of them have a door to the outside. One's an isolation room, and 7 of them have a window bed. I'll show you one of our themed rooms. They're all painted. They're all painted different with matching window coverings and such to fit the theme of the room. Each room has a full-size bathroom with an open shower area, so a wheelchair can come in, or a patient can stand up and take a shower. There's also a shower bench and a door to the outside that you'll notice is wide enough to accommodate a bed or a wheelchair if it needs to go through, so you have your direct access to the courtyard outside. The window bed is so that a caregiver can sleep in the room with the child. And the beds are interchangeable. A crib can be in here for an infant, or we can put a larger bed in as is here right now.
The house echoes with the kids of the family. It's a fun place. It's not a depressing place. They've taken us in just like a family would.
Many of the families who come here for transitional care for their child end up actually coming back at other times for various events that we put on to continue to support those families. We are definitely a home here, and we cook special meals on holidays. We love a party anytime. We have a lot of birthday parties here for not only the child who is here for medical care, but also if there's a brother or sister who's having a birthday during that time that their brother or sister is staying with us. We really believe that this is a home and that life should be lived to its fullest while people are here. And we are a family, and once somebody comes here for care, we consider them a member of our family as long as they want to be a member of the family.
The staff really does, become like family. I mean, you're here enough, everyone gets to be on a first name basis.
We have a support group where parents and other caregivers of children who have spent time at George Mark Children's House can come together and discuss and talk about their issues and support each other.
When I come back to the George Mark House, I always stop and take a breath. I always thank God for the opportunity to come to this house and to experience all the support and love that they provided for our house. We're truly grateful in every way.
It's a joyous place. It's not a depressing place. And it's hard for people to understand that until they come here.
George Mark exists to support a family and to allow a family to be a family at one of the most difficult times in anyone's life.
You walk through the door and you have a situation similar to what we have, and I don't know how you would not want to come here.